The 1,014 complaints, in fact, applications were rejected by SASSA, and we are therefore still under investigation, and we have sent letters of feedback to the affected complainants and are awaiting their response. We also had 38 matters pertaining to alleged undue delay to pay unemployment insurance fund benefits in relation to COVID-19. All 38 of these have been resolved. On the 20 investigations relating to alleged irregularities in the procurement of goods and services in respect of COVID-19, we have made a significant progress. In some of these cases, we are busy drafting Section 79 notices, while in others, we are preparing discretionary notices. In fact, Section 79 notices we prepare where there are adverse findings against whoever is implicated, and others where then the allegations are unsubstantiated. We're sending the discretionary notice to the complainant, informing them that we don't have evidence in the matter. So most of this relates to the complaints in the Eastern Cape and other provinces like Limpopo, Mpumalanga, and Gauteng. So in addition, we've embarked on a blitz which saw us conducting inspections at various public health care facilities across the country. And that was the project which was led by the Deputy Public Protector, and I'll hand over to her to take us through that report, and after that I will then deal with the reports which we are issuing. And I must indicate that we have 2 or 3 very detailed reports which we'll have to take you through, which is the Guyana water project, the Friede report, and the Statute of Johannesburg procurement irregularities report. Over to you, Deputy Public Protector.
Thank you, Program Director, the Public Protector of the Republic of South Africa, the Acting Chief of Staff of the Office of the Public Protector, the Acting Chief Executive Officer, Ms. the
greet you all. As the Public Protector has outlined, I'm going to take you through on inspections that were done by the Public Protector and I through the public health facilities within the country. We embarked on a nationwide tour of about 5 provinces to carry out inspections at various public hospitals where we assessed those facilities' state of readiness to cope with the pressures brought about by the COVID-19 pandemic. This was after the President of the Republic of South Africa, President Cyril Ramaphosa, on the 23rd of March 2020, announced a 21-day national lockdown as part of measures aimed at containing the rapid spread of the COVID-19. The lockdown still continues to this day, albeit with less restriction than was the case in April 2020. The provinces which we had embarked our inspections in were Gauteng, Mpumalanga, Eastern Cape, KwaZulu-Natal, and Limpopo. As we had indicated on various occasions during the inspections, we have now prepared a factual report on our observations. This report has been submitted to the Minister of Health, the Presidency, the Minister of Finance, the Premiers of the respective provinces, as well as the MECs. And the purpose of the report is as follows: to inform the Minister of Health, Dr. Zwelini Lawrence Mkhize, about the challenges relating to healthcare facilities received during our inspections across the 5 provinces. Apologies, I've been asked to remove the mask because clearly I'm not as audible as required. Further, to identify common cause issues at the various hospitals and to request implementation plans with clear and definite timelines from the affected authorities where concessions on inadequate service delivery have been made, and in cases where interventions are already underway. The report covers accountability and undertakings for inadequate service delivery. We took this approach with a view of establishing factors behind the flood of complaints or potential flood of complaints received or to be received by this office. The inspections focused on factors or gaps behind all the problems or complaints reported in some of the 5 provinces, some of which were captured by the media houses in the country. In all, we inspected 17 public facilities across all these provinces, and the breakdown thereof is as follows in no particular order. The first was Gauteng. We inspected the Jubilee Hospital, Dr. George Mkhari Academic Hospital, Steve Biko Academic Hospital, Lillian Ngoyi Hospital, Chris Hani Baragwanath Academic Hospital, Charlotte Maxeke Johannesburg Academic Hospital. In Mpumalanga, we went to Temba Hospital. In the Eastern Cape, we went to Sulenkama, known as Messinites Hospital. Umtata General Hospital, Livingston Tertiary Hospital, Uitenhage Hospital. In KwaZulu-Natal, we went to Christ the King Hospital, Richvlei Hospital, Mbongolwane Hospital, St. Mary's, Kwamakwaza Hospital. And finally, in Limpopo, we went to the Limpopo Capricorn District Hospital as well as to WF Noble Hospital. In the interest of time, I will not go through our observation in respect of each and every one of the 17 healthcare facilities. Instead, I shall focus on common issues identified across all the facilities. In doing so, I will traverse the following thematic areas: PPEs, capacity of vacancies, unions, psychiatry wards, linen or laundry, response times of ambulances, state of facilities and building space, cleanliness of hospitals, and lack of equipment. Starting with the personal protection equipment, there was insufficient procurement, distribution, and provisioning of personal protection equipment to ensure that the staff and the COVID-19 patients were adequately protected from the surge of the pandemic. It was a cause of concern that the PPEs were collected at the warehouse and they were procured by the department and not the hospitals themselves according to their personal needs. There were no dedicated drivers appointed to collect the PPEs at the warehouse, and as such, this contributed to the delay in receiving of stock. Hospitals did not have sufficient PPE. Centralization of procurement in general is a huge challenge for these hospitals. At some hospitals, staff are required to use one PPE for the entire day, even if they have to go out on lunch and back into duty again. Some wards were not provided with appropriate PPEs. Only doctors were provided with full PPEs, and not all medical staff in some instances. Some were required to reuse the masks. An incorrect PPE masks were procured, such as the usage of the N95 PPEs vis-a-vis the KN95. There were incorrect sizes ordered. Inadequate protection of healthcare workers and other staff members due to lack of PPE. Nurses only allowed one bodysuit per day. Incorrect sizes of these suits, which resulted in immediate tearing in some instances. Nurses were forced to wear bodysuits even if it is torn, thereby risking their health. The procured PPEs were not as per specifications. They were also reported to be substandard. PPE stock levels at the warehouse where PPEs were collected were very low and ran out at some stage. Non-delivery of the procured PPEs by the appointed service provider who was on the provincial database. At some point, there were substandard PPEs that were delivered to the hospitals as the gowns were unsterilized and they did not fit the staff complement. Availability of required sizes for some of the PPEs was a challenge, such as boots and goggles. There was shortage of thermometers, shortage of disposable bins, decanters, oxygen points, and the PPEs in general were a huge shortage. Some hospitals were assisted by NGOs which provided PPEs. Capacity of vacancy rate. The lack of staff capacity affected the smooth running of hospitals. Even under the normal course of duties, and this became worse under the COVID-19 pandemic. Posts were not being filled, which has an adverse effect on service delivery. Shortage of staff or insufficient capacity to deal with elective surgeries, clinical, nursing, and support services. Delays in the filling of specialized positions, those are the clinical positions, in the hospitals due to the centralization of procurement to provincial level. Non-clinical posts not being filled, resulting in health professionals assisting with clerical and porting duties. Chronic nursing staff shortage and lack of professional nurses to staff the areas optimally. Workload for the doctors was too high, and they were often expected to work excessive hours as a result of the shortage of clinical staff. And the labor unions, the lack of communication between management and staff, high infection rate of employees, poor relations between management and labor, and lack of cooperation between labor and management. Looking into the psychiatry wards, it is a very serious concern that psychiatry is not as adequately provided for as it should be. In some hospitals, patients are left to lay in casualty where other patients are being received, and has resulted into attacks of other patients and even of staff. In other hospitals, they are caged within the normal wards. Lack of sufficient resource to deal with psychiatry, even the professional staff unable to deal with this specialization, as it takes outside of the normal 72 hours to transfer these patients to the specialized hospitals. In most of these hospitals, it takes up to 2 to 3 months to have these patients transported to psychiatry hospitals, meaning that they remain at these hospitals without being adequately treated and attended to, thus posing a huge risk to themselves, to general members of the public, and also to the hospital staff. In the area of linen and laundry, there are delays regarding the turnaround time in the washing of the linen at hospitals. Staff washing the linen at the laundry of COVID-19 patients don't have the appropriate equipment to protect themselves. Poor maintenance of laundry machines lead to breaking regularly and have challenges in respect of maintenance in this regard. Shortage of linen has serious impact on operations of hospitals. Patients being treated on beds with no linen. Non-functional laundry equipment such as washing machine, dryer, and irons. Insufficient supply of clean linen. Patients have to use their own bedding because of the shortage of linen in hospitals. Response times for ambulances. There's a huge challenge regarding the response times of ambulances. Hospitals do not have sufficient ambulances, especially in the rural areas. Ambulances are not serviced, nor are they cleaned nor sanitized. The state of facilities and building space at the healthcare facilities. There is no compliance with building safety standards for hospitals. Safety doors and lighting detectors are not working. Files of patients' records are on the floor. There's an evident lack of filing room space for storage of files. Archiving has been found to be a serious challenge, which has also been reported to result in some of the litigation that happens against the Department of Health, because most of these records would not be found. Lack of a proper IT infrastructure. Hospitals have infrastructure challenges in respect to space. Infrastructure is old, as some hospitals were built from the 1930s with no proper upgrades. Old hospitals with aging infrastructure. Some dilapidating. Infrastructure problems with buildings such as leaking of roofs, broken toilets. Some male and female patients are forced to share the same toilets. Cracking of walls. General lack of maintenance of the buildings. Lack of network connections for virtual services. The population is increased in certain areas with no proportional increase in hospital space and general service delivery. Shortage of intensive care units. Insufficient consultation rooms. Some doctors are forced to consult in the same room, share the space, and this results in the compromise of privacy of the patients. cleanliness of hospitals, medical waste laying on the corridors in hospitals, lack of proper process for securing medical waste boxes, lack of linings and delays in the collection and disposal of medical waste by the service providers. Lack of equipment, poor ventilation in hospitals, lack of equipment such as piped oxygen, all cylinder gas oxygen being used which has no spares, insufficient oxygen points, general blood pressure and x-ray machines are not enough, susceptible to regular breakdown due to lack of maintenance and being irreparable. Laundry machines are old and irreparable. Shortage of medical equipment such as ultrasound, baby warmers, BP machines, CPAP, suction machines, mobile x-rays, Dynamap and ECG machines. Old and insufficient motor vehicles. For instance, at Umtata General Hospital, when we got there, they didn't have any motor vehicle, as all their motor vehicles were seized by the sheriff. Thus, they could not execute their duties as required. Delays in the maintenance in provincial level of the MRI, radiology, oxygen machines due to lack of contracts with service providers, as these are all centralized to provincial level. Old and outdated x-ray machines, delays in procurement and servicing of geysers, heaters, telephones, and printers, delays by the Department of Infrastructure to service, repair taps, and repair the laundry machine. There's a lack of cooperation between the Department of Infrastructure and the Department of Health, as they are interdependent when it comes to the maintenance and services to the hospital. There's a host of interventions that we propose in respect of each of the facilities to deal with the various issues identified. They are for both the short, medium, and long term. I shall at this stage not go into detail of each and every. Suffice to say, they seek to remedy the challenges that we have identified. For instance, we propose that at Jubilee Hospital, the department must in the short term ensure that it capacitates the hospital with respect to conducting its own COVID-19 tests. The procurement of COVID-19 test kits will assist in alleviating the turnaround time for the test, especially in light of a possible second wave which we are in. To ensure that sufficient and adequate PPEs are received by hospitals upon collection from the depots. The PPEs must be in line with the requested specifications, and the department must immediately train all staff in relation to the risk strategy and the work of the risk management committee, which we have found is not operational in most of these hospitals. In the medium to long term, the department must ensure that the hospitals have a business continuity management plan regarding the manner in which elective surgery is phased in post-COVID-19, and ensure that there is sufficient ambulances to cater for the needs of the masses who must access health care. In the case of Dr. George Mukhari Academic Hospital, we propose interventions that have to do with risk management and business continuity. The full details of the interventions per facility can be found in our full report, which will be accessible on our website by this afternoon. But to mention, before I complete, at Lilian Ngoyi Hospital, where mothers lay there after giving birth without proper nutritious food, without heaters, without geysers to wash themselves and their babies. This needs to be addressed urgently. As a way forward, the oversight role of the minister, the premiers, and the MECs will be important in steering the process of assessment of the effectiveness of hospitals to achieve good governance. and efficient and effective service delivery to the people of South Africa. The Office of the Minister should submit an action plan on how the affected hospitals will address the issues that were raised during the inspections. I shall now hand over to the Public Protector Advocate Mkhwebane to take you through her findings on a number of other investigations.
Thank you, GPB. Before I take you through my findings in the various matters, let me indicate that the following 5 matters have been closed on the basis that the allegations that gave rise to the investigations concerned were not borne out of fact and therefore unsubstantiated. I will merely list their long titles. The full reports will be available on our website later today. They are as follows: maladministration, irregular recruitment and procurement, as well as irregular increases in salaries by the South African Maritime Safety Authority, as alleged by Mr. Themba Ntshangase in a complaint lodged on the 5th of September 2017. The second one is undue delay by Armaments Corporation of South Africa, AMSCO, in the issuing of an outcome of an investigation conducted by Fairbridges, Wetham Becker attorneys into alleged tender irregularities and failure by AMSCO to award a project package tender as alleged on 30 August 2019 by a complainant, Ms. Lamini, who is the managing director of Deradia. Maladministration by the government officials who benefited from the government funding by leasing state-owned farms and used their relatives for fronting and as beneficiaries of these farms, as alleged by Mr. Sipho Maseko. Another closing report relates to allegations of violation of Executive Members' Ethics Code by the KwaZulu-Natal MEC for Health, Ms. Simelani Zulu. Another closing report relates to allegations of maladministration and improper conduct by the Culture, Arts, Tourism, Hospitality and Sports Sector Education and Training Authority, which is CATSETA, and the Department of Higher Education and Training, in the matter which was lodged by South African Roadies Association. Allegations concerning the following 9 reports or matters have been substantiated and appropriate remedial action have been taken in respect of each. These matters cover themes such as pensions of government employees, housing, irregular appointments of staff, and procurement. I list the below long titles of the first 6 and deal with the last 3 reports. Copies of the full reports will also be accessible from our website later today. Report number 8 of 2020-2021 is an investigation into the allegations of improper conduct and maladministration relating to the appointment of acting municipal manager by Guyana local municipality in Northern Cape, which complaint was lodged in 2018. The second one is report number 10 of 2020-2021 on an investigation into allegation of maladministration, nepotism, irregular expenditure, and the irregular appointment of Ms. Lali Chauke to the position of Human Resources Officer by the South African Council of Educators. Report number 12, 2020-2021, it's an investigation into allegations of improper conduct and maladministration by the Walter Sisulu local municipality in the Eastern Cape relating to the failure of to transmit pension fund contributions deducted from employee salaries to the South African Local Authority pension fund. The report number 4 relates to report number 13 of 2020-2021. It's an investigation into allegation of maladministration, improper or suspected improper conduct in the appointment of Mr. Govender to the position of Chief of Emergency by the Tshwane Metropolitan Municipality. Report number 5 relates to report number 94 of 2019-20. This is an old report on the investigation into allegations of improper conduct and maladministration relating to the appointment of Mr. Kongo as the driver messenger by the John Taule Gaetsewe District Municipality in the Northern Cape in 2017. The next report, report number 117 of 2020-2021 on an investigation into allegations of improper conduct and maladministration by the Buffalo City Metropolitan Municipality relating to the provision of title deeds to beneficiaries of the RDP houses in King Williamstown. So the next report I'll be detailed in reading our findings. It's Basson versus the Department of Human Settlements, Water and Sanitation, which is report number 14 of 2020-2021. We've investigated maladministration by the Department of Human Settlement, Water and Sanitation, formerly known as the Department of Water and Sanitation, which is DWS, in awarding various contracts. And the complaint was lodged by Mr. Basson of the DA Deputy Shadow Minister of Water and Sanitation on the 18th of August 2016. So this is one of the old backlog matters. He alleged that the previous Minister of Water and Sanitation, Ms. Mkhwebane, was involved in irregularities in awarding the following tenders at the DWS: repairing water infrastructure in the Mopani District Municipality, a project for which the budget escalated from 96 million to 506 million in 3 months. The raising of the Hazelmere Dam wall, a project which was approved in 2011 with a budget of 91 million and the projected to cost 359 million. At the end of this report, with no end date, the building of Glen William Dam wall and the 36-kilometer pipeline between Craigieburn and Greyton. In essence, the complaint was that these projects had fallen victim to tender manipulation and political interference. After a thorough analysis of the complaint, I decided to investigate the following 5 issues: whether Lepelle Northern Water Board irregularly awarded the contract for the provision of water and sanitation services in the Mopani Guyana project to LTE Consulting without following procurement legal prescripts. The second issue, we investigated whether there was maladministration in the DWS Nandoni Ntsami Guyana bulk pipeline project. The third issue, whether former Minister Nomvula Mokonyane was involved in the irregularities in raising of the Hazelmere Dam wall, and if so, whether such involvement constitute improper conduct. And the next issue, we investigated whether the former Minister Mokonyane was involved in irregularities in the raising of the Glen William Dam, and if so, whether such involvement constitute improper conduct. And the next issue was whether Mr. Mokonyane was involved in irregularities in the building of the 36-kilometer pipeline between Craigieburn and Greyton, and if so, whether the involvement constitutes improper conduct. Before dealing with the findings, let me provide a bit of context to help the public to understand how we arrived at the conclusion of this report. A copy of the appointment letter dated 24 August 2014 from the Lepelle Northern Water Board to LTE was perused. The estimated period of the work to be completed between 4 years, 13 months and 2 weeks. The estimated amounts were that Guyana Waterworks will cost 52,150,000 and the Guyana Water Waste Work will cost 38,800,000. By the 25th of August 2014, Ms. Mkhwebane forwarded a letter to the Lepelle Water Board, which inter alia issued a directive to Lepelle in terms of Section 41(1) Roman figure 2 of the Water Services Act 108 of 1997 to intervene with effect from the 18th of August on the Guyana Water and Waste water treatment in order to restore water supply to the residents. And on the 27th of August 2014, the Lepelle Water Board wrote to National Treasury and informed them that the Lepelle Northern Water Board was appointed as an implementing agent by the Department of DWS. As such, Lepelle Water had appointed LTE on a deviation due to the emergency nature of the project. Therefore, Lepelle was issued then, issued South Zambezi with an appointment letter for engineering and project management services for the following amount. So for the Guyana Waterworks, they issued for the estimated project management services fee was 1,100,000, and for the engineering services fee was 2,475,000. Whereas at the Guyana Water Waste, it was the project management services was around 807,500, and then for engineering fees was 1,842,000. And same day, Lepelle issued Car2 Civils with an appointment letter for the construction service for the following amount. For the Guyana Waterworks, it was 45 million, excluding VAT, and for the Guyana Waste Waterworks was 33,500,000, excluding VAT. And same day, LTE issued LTE Civil and Structural P2I Ltd with an appointment letter for engineering and procurement, in fact, for project management services for the following amount. For the Guyana Waterworks, 2,475 million, 2,475,000, and then for the Guyana Waterworks, it was relating to still the 807,500, which I've mentioned up there. So at the end of the day, the Lepelle North Water Board issued a letter. In fact, there was a letter which was issued to LTE, which we've perused, where they were appointing LTE for an estimated amount of 2,211,000 for a period of 5 years. A contract for emergency water and waste water intervention in Mkhwebane District Municipality on a 10-key basis was signed between Lepelle Water Board and LTE. It was October 2014, which Lepelle was represented by Mr. Lukhodi, whereas LTE was represented by Mr. Majola. So the cost price, as I've indicated above, 2,211,425,000. A copy of the invoice dated 13 October 2014 from Car2 Civils also was perused, and they've invoiced for an amount of 170 million. This invoice was signed by Mr. Lukhodi on 14 October 2014. It was noted that this amount was paid 1 month after the contract was awarded. A copy of the program implementation plan also was assessed, where Mkhwebane District Municipality Water and Sanitation Revitalization Program was perused. This was compiled by Lepelle North Water for Lepelle by LTE. It was noted that LTE was appointed on an engineering, procurement, and construction basis for the project. So there are different amounts which we are picking up from the documentation. Then there's also an addendum to the service level agreement, which increased the contract now from 2,211,000,000 to 2,808,000,000. And we could also see that Mr. Lukhodi also wrote to National Treasury and informed them about the appointment of Lepelle as the implementing agent for this particular project, and that Lepelle has appointed LTE for this project on a 10-key basis. But again, there was another letter which Mr. Lukhodi wrote to LTE, where they then informed LTE that the total cost for this Guyana intervention project will be, and including approved variations, was now 2.9 billion. So on the 18th of July 2019, we then interviewed, in fact, we wrote a letter to Mr. Chivase, the chairperson of the board of Lepelle, in response to the inquiry which the investigators wrote to him, and that in 2009, a drought caused water levels in the Ntsami Dam to drop to the extent that there was insufficient water to ensure a supply of water to the population of Guyana. So a local state of disaster was declared in terms of the Disaster Management Act of 2002, and the emergency measures had to be implemented to restore water services. So the Department of Water and Sanitation then appointed Mopani District Municipality as the implementing agent to implement and manage the project, and Mopani District appointed a certain contractors to implement the project. However, these contractors were challenged by unsuccessful bidders, the High Court alleging that Mopani District appointed these contractors irregularly. Now, the Supreme Court of Appeal declared the contracts void ab initio and set them aside in August 2014. And when that happened, on the 12th of August 2014, Ms. Mkhwebane held a government imbizo with the community of Guyana, of Mopani in the Guyana area. The primary aim as well of the imbizo was to assess the scale and enormity of the crisis and progress in relation to measures that had been taken by government to address the water problem. So this has happened in 2019 already, and a disaster was declared in 2019. So by then in 2014, when Ms. Mkhwebane was directing the imbizo, or at the in fact after the imbizo, directed Lepelle Water Board that they need to be appointed as implementing agents, because the Supreme Court of Appeal has then declared the other appointment, which was the Mopani District as the implementing agent and those service providers, that was set aside. Now there was this process of appointing Lepelle as the new implementing agent, and that was done in terms of Section 41 of the Water Services Act. Pursuant to this, they then, Lepelle Water Services appointed LTE on a 10-key basis. A 10-key solution or project means a type of project that is constructed so that it can be sold or handed over to the owner as a complete project. So that's what happened. Mr. Chivase further stated that at the time of the project, Lepelle did not have a panel of service providers when it was appointed by Department of Water and Sanitation as an implementing agent. So then Lepelle decided to use the Department of Water and Sanitation panel of services to service providers, and that's where they found LT Consulting, which was confirmed as a Category 6 of the panel of professional service providers. A copy of the Auditor General South Africa's engineers report dated 29 July 2017 was also perused by the investigators, and it was clear that, according to the report, LTE was charging rates that were above the Department of Public Service and Administration and that of the Department of Public Works. For example, AGSA report stated that the top rate for a consultant working at the level of a director was 1,300 per hour, according to the DPSA scales, and the top rate for a registered professional principal was 1,448, which is according to the DPW, which is Public Works scales. So LTE was charging up to 3,500 per hour. Due to the fact that this project was never placed on tender, LTE was allowed to charge any rate that they desired. This was not value for money, fair, equitable, and cost effective. So according to the Auditor General's report, it was noted as well that CAR2 Civils was charging higher rates compared to other companies doing similar work. Once again, this was allowed to occur because LTE got the project without following the proper procurement processes. This, in essence, allowed the subcontractors to charge higher rates. This was not value for money as well, as we've indicated up. So we also received a letter from Godfrey Madubanya, the Legal and Compliance Officer from Construction Industry Development Board, which is CIDB, where he advised my office that LTE was not registered with the CIBD. Furthermore, he stated that in terms of Section 18 of the CIDB Act, all contractors have to be registered with the CIDB prior to rendering construction services to state public entities. So we then compiled a Section 7(9) notice. We also sent to the DG of Water and Sanitation, Mr. Trevor Blazer, who then disputed this allegation that indeed LTE was not registered with the Construction Industry Development Board because LTE was not a construction company, but it was a consulting company which was appointed on a turnkey basis, and also alleged that the public protector's preliminary findings were not substantiated. Further, that LWNW did not have a desired relationship with CATU Civils because CATU Civils was appointed by LTE, which LTE also relied on CATU Civils, and CATU Civils had these desired registration documents. And again, that the construction company, which is CATU Civils, they've done their work, and there was nothing which was found that CATU Civils have done shoddy work. So accordingly, it is submitted that the conclusions which were made by the public protector in the report on the appointment of LT was irregular, irrational, and not substantiated by evidence. So that's what the Department of the DG of Public Water Affairs was saying. So the conclusion to that effect, again, that the appointment of LTE was improper and constitute maladministration, irregular, fruitless, and wasteful with respect is not corroborated by any evidence. So that's what Water Affairs is saying. And also Water Affairs was saying the SIU has instituted legal proceedings as indicated above, challenging the appointment of LTE. Therefore, they propose in the circumstances that PP should keep this investigation in abeyance, again further delaying the provision of water to the people of Guyana. So, which is a challenge, and again the interventions by the courts, that's where then it also impacts on service delivery. So in June 2020, we received a response to our Section 7(9) from Mr. Lukhodi, from the CEO of Lepelle, who submitted his response and stating that the minister signed the directive approving the recommendations outlined in a submission by the then acting DG of the Water Affairs, expressly stipulating that additional costs be submitted on completion of the business plan. According to Mr. Lukhodi, the directive expressly provided that it was saying, I therefore direct you to proceed with the implementation of the directive with immediate effect whilst the internal administrative procedures are being fast-tracked. You are also directed to establish a multi-stakeholder implementation steering committee to oversee the technical progress of the progress and submit to the acting DG, Mr. Trevor Blazer, a comprehensive business plan. So, and then Minister was going to establish a political steering committee. So there is no doubt at all from reading the directive that the emergency implementation program of the project was designed by the Minister as an emergency intervention and to be implemented as a multidisciplinary project. Similar directives was addressed by the Minister to the Premier of Limpopo, Executive Mayor of Mopani, as well as Minister of Cooperative Governance. So our conclusion then on going through the facts, the legal prescripts, we have concluded that the version of Lepelle that where a deviation process applied, Section 217 of the Constitution was not applicable. Section 217 provides for a fair process, a competitive process, and their reasoning was that that is not applicable because it was an emergency. This version is improbable due to the amount of the project and the fact that the new project was approved for a period of 5 years. The project should have followed an open, competitive bidding process and proper procurement process. The conduct of Lepelle has deprived the state to obtain or approve a project that was value for money. So the use of emergency narrative should not have been a reason for Lepelle to evade the procurement procedures. In fact, for this high value budget, a formal procurement process should have been followed. That is a tender process that should have been fair, equitable, transparent, competitive, and cost effective. Therefore, Lepelle cannot create an emergency narrative that leads to nearly 3.8 billion being spent without the project being completed at the end. So this was unjustified. The drought in the area occurred in 2009, and the area was declared a local state of disaster from then. Furthermore, the Mopani District Municipality in 2009 was appointed by Water and Sanitation as the implementing agent to manage the project. So when MDM appointed contractors to implement, that was challenged in the court. So again, that's where the process of provision of water to the Guyana community was delayed because the court set aside that particular contract. But then Mopani should have then acted quicker and with the Department of Water and Sanitation to appoint or follow the proper process. So it is the version of Department of Water and Sanitation that they complied with the relevant prescripts by availing service providers from their panelists, the panel of service providers, to Lepelle to use. So it was concerning to note that this project ended up costing this 3.8 billion, which went beyond the due date of the project completion, and towards the end, approximately this amount was spent. I mean, we know what the provisions are saying. Again, what was concerning is that Katu Civil had claimed payments from Lepelle of approximately 170 million during the period 25 September 2014 to 26 October 2014 in just 1 month. This was after Katu Civils were just appointed during August 2014. So Katu Civils claims this amount as advances and for measured work. This amount was exorbitant and Lepelle should not have allowed this to occur. Furthermore, that this is concerning was that the amount was paid to Katu Civil in that first month was more than the budget for the first approved budget for the project. So we also received a response from Mr. Schmal from Water and Sanitation, who also, we've perused their internal document, who quoted that Lepelle's SCM policy regarding the deviation on the basis of emergency and stated that their policy allows the chief executive that can approve a deviation from normal procurement procedures due to emergency cases when life and limb are at stake. This was factually incorrect as the 2012 SCM policy did not have such a provision. So he was referring to a SCM policy which was developed in August 2015. So Mr. Schmal misrepresented the facts to push this project for the benefit of LTE. Further, Schmal prepared the deviation memorandum. It was signed 19 August 2014. So these are the facts which would want the public to be aware why we came to the conclusion which we came to as the public protector. And therefore, we have then discovered that there's information or some of the information relating to this particular complaint, especially the role of the minister in the other mentioned dam, where we have found that there is no substantiation which we could find on those issues. So following this rigorous investigation, which included scrutinizing the bank accounts belonging to some of the alleged officials, we made the following findings. The allegation that Lepelle improperly awarded the Mopani Guyana project to LTE without following proper procurement processes is substantiated. And this substantiation is based on the fact that the crisis or that area was declared a disaster in 2009 already. And when the minister visited the place in 2014, there was that challenge. Therefore, they couldn't use that excuse not to follow the transparent process. The allegation that Mopani district had committed maladministration in regard to Nandoni Nzami pipeline project is also substantiated, because this Mopani district municipal manager, Mr. Mankabidi, failed to ensure that the contract was properly managed, and the Nandoni Nzami bulk pipeline project in Guyana was not completed, but approximately 248 million was utilized. So the allegation that Minister Mkhwebane was involved in tender irregularities in the Hazelmere Dam project, that one is not substantiated, because there's no evidence which could be found that Minister Mkhwebane was involved in the tender relating to the raising of the Hazel Dam, and as well there's no substantiation about the raising of the Clan William Dam, and including the irregularities in the Greytown project, which is also not substantiated because we don't have evidence of her involvement in those areas. In the light of the above findings, the remedial actions are as follows. In regard to Nandoni Nzami pipeline project and Mopani district municipality, the Minister of Human Settlements, Water and Sanitation must within 90 days from date of this report appoint engineers who can advise on actual work done by the previous service providers versus payments made in terms of value for money for the project. The board of Lepelle must within 60 working days from date of this report take appropriate disciplinary action against the implicated officials at the Lepelle, and report to National Treasury and AG particulars of the identified financial misconduct and the steps taken in connection with such financial misconduct in terms of Section 85 of the PFMA. Ensure that Lepelle collaborates with National Treasury in conducting a forensic investigation into this contract since 2014 and takes up measures to address any findings regarding systemic administrative deficiencies, allowing ongoing maladministration and related improprieties in its procurement system. Within 90 days from date of this report, institute civil proceedings against the implicated Lepelle officials for the recovery of the such appropriate and reasonable amounts which were lost in the regular awarding of the Mopani Guyana project. That is all inflicted costs and rates in this regard. So the DG of Human Settlement, Water and Sanitation must within 60 days from date of this report review the department's policies in respect of implementing agents. Further checks and balances need to be incorporated, and greater control must be exercised over implementing agents to avoid them exceeding contract values agreed to with the department. In addition, the head of Directorate of Priority Crimes Investigations consider registering an inquiry to investigate acts of possible corrupt activities in connection with the awarding of this project by Lepelle to LTE. The next report relates to Anonymous versus the City of Johannesburg, which is report 21 of 2020-2021. This was a complaint which was lodged in 2018 by anonymous complainant, and the complaint covers 4 distinct themes, namely irregular appointment of staff, irregular salary increases, financial mismanagement, and conflict of interest. Allegations of irregular staff appointments involve the appointments of the Executive Director of Housing, Group Head of Legal, Group Forensic Investigation Services, Executive Head, and Chief of Johannesburg Metro Police, and the current City Manager. Regarding alleged irregular salary increases, former Chief of Staff, Mr. Michael Beaumont's salary was irregularly increased, allegedly with the full knowledge and consent of the former Executive Mayor, Mr. Mashaba. On financial mismanagement, the complainant alleged that the city returned nearly 736 million to National Treasury in funds that were allocated as conditional grants for the year which ended 30 June 2017. National Treasury allegedly served the city with a letter of demand in October 2017 to recover this money. It was alleged that the city, due to poor performance, failed to spend the conditional grant, and the money was allegedly meant for the provision of basic services for the residents, including water and sanitation, roads, housing, electricity, and waste, amongst others. This was to the complainant an indication of non-compliance, mismanagement, and poor oversight by the Democratic Alliance-led administration. In addition, the city allegedly appointed KPMG to conduct investigation in various departments, including the Revenue Unit, in 2016. In 2017, the services of KPMG were allegedly retained to perform analysis of the customer accounts in the city's database and develop strategies to improve the city's revenue collection. These were allegedly different assignments which would require different expertise. While the final appointment was made via a panel of forensic service providers, which KPMG belonged to, the second allegedly did not follow, or the city didn't follow the required prescripts. So what we then did, there was also a complaint that in terms of the conflict of interest, the city allegedly awarded a multi-million tender for forensic investigation to Grant Thornton Capital, a company called Lipatsi Financial Services, which is allegedly owned by the former executive mayor's wife, and it owned 35% stake of Grant Thornton Capital. So the former executive mayor is alleged to have unlawfully and irregularly solicited free services from Lipatsi Financial Services. So the executive mayor is also alleged to have had a breakdown with Sitewo Engineering Company, which was appointed by the city due to personal vendetta against them, since Sitewo is in the same business as Conco, which is a company allegedly associated with the mayor. So on the 23rd of November 2018, my office further received another complaint from the directors of Sitewo alleging administrative irregularities in the termination of the NEC3 contract, failure to respond to communication, bad publicity, abuse of power by the former executive mayor, and maladministration around subcontractors by City Power and the city. Following the lodging of a separate complaint by the directors of Sitewo, this issue was then separated from this investigation, and it is being investigated by my office on its own. So it was further alleged that the former executive mayor interfered with the funding allocation of the city of a youth drug rehabilitation and support program to fund NGOs known as Field Band Foundation, which he claims as a personal project. After analyzing the complaint, we've identified 11 issues: whether the city improperly or irregularly appointed Mr. Moses Metileni to the position of the Executive Director Housing without following due process, whether the city improperly or irregularly appointed Mr. Mukhashwa to the position of Group Head Legal and Contracts without following due process, whether the city improperly and irregularly appointed Dr. Lukwareni to the position of City Manager without following due process. Another one is whether the establishment of Group Forensic Investigation Services and the subsequent appointment of General Shadrach Sibia as its executive head by the city were improper and irregular. Number 5, whether the city improperly or irregularly appointed Mr. David Tembe to the position of the City of Johannesburg Metro Police without following due process. Number 6, whether the city irregularly increased the Chief of Staff, Mr. Buman's salary. And number 7, whether the city returned the 736 million to National Treasury. Number 8, whether the city improperly or irregularly appointed KPMG to conduct investigations in various departments without following processes. And number 9, whether the executive mayor of the city or the former executive mayor, Mr. Mashaba, unlawfully and irregularly entered the procurement space and solicited free services from Lipatsi Financial Services, and whether such amounted to a conflict of interest. Number 10, whether the former executive mayor of the city, Mr. Mashaba, allegedly interfered or influence the city to use funding allocation of youth drug rehabilitation and support program to fund Field Band Foundation, which is a non-governmental organization. Number 11, whether the complainant, the city or any other party suffered improper prejudice in the circumstances. So following a rigorous investigation by the Gauteng Public Protector Office, we are making the following findings. The city improperly and irregularly appointed Mr. Metileni to the position of Executive Director Housing without following due process. And the second one, the city improperly or irregularly appointed Mr. David Tembe to the position of Chief of Johannesburg Metro Police without following due process. The next one, the city improperly and irregularly appointed KPMG to conduct investigations in various departments within the city for clearly different assignments which would require different expertise without advertising the tender as required by the Municipal Finance Management Act and Supply Chain Management Regulations. Number 4, the former executive mayor of the city, Mr. Herman Mashaba, unlawfully and irregularly entered the procurement space and solicited free services from Lipatsi Financial Services, and whether such amounted to a conflict of interest. So there was a finding in that one. Number 5, the former executive mayor allegedly interfered or influenced the city to use funding allocation of youth drug rehabilitation and support program to fund Field Band Foundation, which is an NGO and which he said is for his own personal project. So the rest of the other allegations were not substantiated. So in the light of the above findings, the following remedial actions are taken. The city manager must take appropriate steps to ensure that within 60 working days from date of this report, disclose all irregular expenditure incurred in connection with the irregular appointment of Mr. Miteleni, Mr. Tembe, and irregular extension of the contract of KPMG to the Council and Treasury. Directs the CFO of COJ to amend the closing balance of the current financial statements to accordingly include the irregular expenditure in the previous financial statements. Within 60 working days of the date of the issue of this report, all COJ officials who were involved in the SCM and recruitment processes, including all senior management, attend a workshop on SCM recruitment and selection procedures, and within 60 working days from the date of this report, present this report to the current executive mayor of the city for disciplinary action to be taken against all current city employees who are responsible in the recruitment and the supply chain processes. The Speaker must, within 60 days, ensure that the Council develop a policy regulating the exercise of discretionary power delegated to the Executive Mayor in relation to grants for funding or donations to institutions or organizations which promote public health, social welfare, arts, culture, and education within the city, as contemplated in Section 79(16)(a) of the Transvaal Local Government Ordinance, which is applicable within the city currently. So within 60 days, also all councillors attend a workshop on management of conflict of interest and on policies relating to mandatory disclosure of conflict of interest. And further, the MSC for Cooperative Governance and Traditional Affairs in Gauteng provide province address all irregular expenditures which have been incurred. CEO of Road Traffic Management Corporation must take appropriate steps to ensure that within 60 working days from date of this report, engage the necessary process to nullify the Metropolitan Traffic Police diploma issued to Mr. Tembe by JMPD on June 20, 2007, and further disclose or communicate the outcome of the nullification process to the HOD for Gauteng Department of Roads and Transport. So the final report relates to the Portfolio Committee on Justice versus the Free State Provincial Government, which is what we call the Friede report. I deem it necessary to tell the story of the Estina Dairy project case from the beginning for context. As you know, when I took over the Public Protector mid-October 2016, I inherited a number of investigations which my predecessor, entitled Advocate Madonsela, could not conclude. I had to pick up where Advocate Madonsela left off and finalize those matters. Among those investigations was the Estina integrated dairy farm matter. When I got involved, there was already a draft report dated November 2014. This suggests that the investigation was finalized nearly 2 full years before my arrival. A copy of that report can be found on the Public Protector's website for ease of reference. 2 back-to-back complaints from Dr. Jackelson, the DA member in the Free State, triggered the investigation. The one complaint was dated 12 September 2013. The other was dated 28 March 2014. In both those complaints, the complainant never made any allegations whatsoever against any politician. I emphasize this because the scope of any investigation, of our investigations, is determined by the complaints and the specific allegations made against whoever the subject of the investigation. And I must indicate this was investigated by our Free State Provincial Office. Accordingly, when the investigation commenced in 2013, the focus was purely on issues that were contained in the complaint dated 12 September 2013 and later included issues dealt with in the second complaint of 28 March 2014, which also had nothing to say about the conduct of the politician. Dr. Jackelson lodged a third complaint, which is 10 May 2016, which did not form part of the investigation as the office already was at an advanced stage. This was 2 to 3 years down the line, and needless to say, the investigation was already at an advanced stage. With the exception of an allegation that former Minister MEC Mkhwebane refused to answer questions during a meeting of the Portfolio Committee on Economic Affairs, no allegations of impropriety were leveled against any politician, even in that third complaint from Dr. Jackelson. These things can easily be verified. We have the copies of those complaints, but also they are mentioned in report number 13 of 2018 of the Public Protector. So that one which was set aside, report number 31 of 2008. So it is a matter of public record that I concluded the investigation and proceeded to issue it in February 2018, and also public knowledge that the Gauteng the Gauteng Division of the High Court of South Africa reviewed and set aside that report, declaring it unconstitutional and invalid. You will also be aware that attempts on the part of my office to appeal that ruling, both the Supreme Court of Appeal and the Constitutional Court, were unsuccessful because they were also having personal cost orders and also setting aside the report which already was implemented by the Free State Provincial Government. It is important to set out this background to this matter so that the case can be put in proper context. I now turn to the Friday project matter. I investigated the allegations of suspicion of political involvement in the Friday Dairy project by the Free State Provincial Government and possible prejudice suffered by the intended beneficiaries of the project. On the 6th of March 2018, the Portfolio Committee on Justice and Correctional Services raised concerns relating to political involvement in the Friday project implemented by the Free State Provincial Government and possible impact on the intended beneficiaries of the project. It is on the basis of the concerns raised by the committee that I was requested to conduct the investigation focusing on these issues. While finalizing the current investigation, I received a letter from, again, the same Dr. Jackelson on the 17th of June 2020 requesting that I include the scope of my investigation, the issue of contravention by politicians of the Prevention and Combating of Corrupt Activities Act number 12 of 2004, which I'll refer to as PRECA. He stated as follows: it would appear that the former Premier of the Free State, Mr. Ace Magashula, and the MEC, the then MEC for Department of Agriculture and Rural Development in the Free State, Ms. Mamiki Mkhwebane, and the former MEC of Finance, Ms. Elsa B. Rockman, not only contravened Section 34 of Chapter 7 of PRECA, but aided and abetted what had already been identified as possible corrupt activities by making additional payments to the project after receiving the Accountant General's report and after the termination of the contract. We therefore kindly request the Office of the Public Protector to include in her final report a determination of the interpretation of Section 34 of Chapter 7 of PRECA, whether the above-mentioned individuals are complicit in terms of PRECA. In a statement, in the subsequent letter of acknowledgement to Dr. Jackalson's new complaint, I inform him that the issues contained in his complaint relating to PRECA will be taken into consideration in line with the relevant prescripts, which is the Public Protector Act. So in terms of Section 1A of the Public Protector Act, the Public Protector shall have the power to conduct a preliminary investigation for the purpose of determining the merits of the complaint, allegation, or information, and the manner in which the matter concerned should be dealt with. A preliminary assessment of the Dr. Jackalson's complaint established the following. Section 34 of PRECA places a reporting obligation on any person who holds a position of authority and who knows or ought reasonably to have known or suspected that any person has committed an offense mentioned in Section 34 1A and B. So the reporting obligation is limited to Section 34.4, which states that for the purposes of Section 34.1, the following person hold a position of authority, namely the DG or head or equivalent of a national provincial. In case of municipality, the municipal manager. In case of any public officer in the senior management service, a head, rector, principal of a tertiary institution, manager, secretary, or director of a company, the executive manager of any bank or financial institution, any partner in any partnership, any person who has been appointed as CEO, any person who is responsible for overall management and control of a business, and that's what Section 34.4 of PRECA is saying. So based on that, the executive authority of a provincial government, which is EXCO, in particular the former Premier of the Free State, Mr. Estina, the member of the MEC, of the Executive Council, which is MECs, responsible for Free State Department of Agriculture and Rural Development, Ms. Mamik Kabate, and the former MEC, Ms. Rockman, or MEC of Finance, are not listed as persons who have a reporting obligation in terms of PRECA. However, acting on the basis of the legal precedents enunciated in the Malian Guardian judgment of the Public Protector versus Malian Guardian, the court held that the Public Protector is not a passive adjudicator between the citizens and the state, relying only upon evidence which is placed before her by the parties. The SCA held further that the Public Protector should not be bound or be limited to the issues raised for consideration and determination by the parties, but should investigate further and discover the truth, and also inspire confidence that the truth has been discovered. So the court further made it clear that the mandate of the Public Protector is an investigatory one, which requires proaction in appropriate circumstances, that the Public Protector, although the Public Protector may act upon a complaint that is made, he or she can take the initiative to commence an inquiry and on no more than information that has come to his or her knowledge of maladministration, malfeasance, or impropriety in public life. So the court emphasized that where the Public Protector has a proactive function, they should investigate. So although Section 34 places no reporting obligation on EXCO, I have taken a decision to consider the contact of Mr. Makashule, Ms. Kabate, and Ms. Rockman in exercising their responsibilities entrusted to them in terms of Section 125, 133, 136, and 195 of the Constitution. Whilst about to complete my investigation, the appeal to Report 31 of 2018 was then set aside, which I've mentioned up there, and finally by the Constitutional Court in August 2020. On analysis of the complaint, so in this matter, I wouldn't be dealing with the violations of the Treasury prescripts and that, because that is a pure responsibility of the accounting officer, which is the DG or HOD. So on analysis of the complaint, the following issues were identified to inform and focus the investigation: whether there was any political involvement in the Frede Dairy project by the Free State provincial government, and if so, whether such conduct amounts to maladministration and improper conduct, whether there was possible prejudice suffered by the intended beneficiaries of the Frede Dairy project, and if so, whether that constitute maladministration. So the investigation process commenced with a preliminary investigation followed by a formal investigation which was conducted through exchange of correspondence with the Free State Provincial Government, interviews with Mr. Mkhwebane, Mr. Zwane, Tabete, Mr. Mutaung, Ms. MEC Kabate, Ms. MEC Rockman, as well as the beneficiaries of the Frede project. Information was also sought from the State Capture of Inquiry, banks, and affidavits obtained from former officials of the department as well as former EXCO members of Free State Provincial Government. Section 9 notices, that's where if people are implicated, were served to Mr. Mkhwebane, Zwane, Tabete, Ms. Mutaung, MEC Kabate, and Rockman. So responses thereto were received and have been considered in the report, which report will also be published in our website. So perusal of the relevant documents and correspondence receipts, as well as analysis and application of the relevant laws, that's what we took into consideration. So the Public Protector's powers and jurisdiction to investigate and take appropriate remedial action was not disputed by the department or any officials. However, Mr. Mkhwebane, in his response to Section 79 notice issued to him, raised issues pertaining to my jurisdiction to investigate the complaint in the original form and as amplified by Dr. Jackelson, as well as which we've addressed above. So Mr. Mkhwebane argues, amongst others, that this is due to the fact that the events complained of and my findings all do or will exceed the statutory 2-year limitation of the Public Protector's remit, which is, he stated that this is contrary to Section 6, subsection 9 of the Public Protector Act. Further, that my approach in this matter did not disclose a single reason why this case qualify as an exceptional circumstance that may allow me to extend the temporal limitation of my jurisdiction, which I need to make clear that that is within the Public Protector's discretion to come up with exceptional circumstances. So Mr. Mkhwebane's argument in this regard is noted, and although the exceptional circumstances that would allow me to exercise my discretion to investigate the matter was not detailed in the Section 79 notice, it should be noted that in applying my discretion to investigate the matter, I considered that the allegations made relating to the involvement of politicians in the misuse of public funds and the prejudice suffered by the beneficiaries are addressed to its finality. It should further be noted that the exceptional circumstances relating to this investigation were addressed in statements issued by both the Portfolio Committee of Justice and myself, as to why it's important to investigate the issues which were raised by the Portfolio Committee and which suggested that there was political meddling in the Frede Dairy project, which my office had not dealt with in report number 31 of 2018. Mr. Mkhwebane, in his interview with me, did not raise any objection to my jurisdiction in the investigation of this matter. So on October 18, 2018, I interviewed Mr. Mkhwebane, the former Premier, and during the interview, I questioned Mr. Mkhwebane whether he was involved in the planning implementation of the project, which he replied that he was not involved. He indicated that the Frede was brought and presented to EXCO by the Department of Agriculture and the Department of Finance in the province, during which time Mr. Zwane was the MEC and Mr. Seiso Muhai, who was the MEC of Finance. He stated that the MEC of Agriculture, supported by the MEC of Finance, made a presentation to EXCO, and after discussion at EXCO adopted the dairy project, and that is going to be benefiting the public, and they will put money, and they will also going to make sure that the National Department of Agriculture is involved. Stated that EXCO meetings, in their main, they would have the MECs supported by the relevant HODs, and there was also a memorandum which we have as part of our records, which was submitted by MEC Zwane to EXCO. Now, there were conclusions which we've made after receiving all this evidence, which evidence has uncovered that the The evidence uncovered by my investigation team has derived a factual depiction of what transpired from the conception and implementation of the project. The evidence from various sources revealed from interview statements canvassed above indicate that there was indeed political involvement in the project, who hold both, in fact, those who are members of EXCO, who hold both positions of, as head of their respective portfolios, as well as being members of political parties. So the role of EXCO as the provincial executive authority is taking part in the deliberations to consider and approve the project as would have been tabled by the relevant MEC, followed by approvals of submission, funding of the project, and subsequent requests were made in this project. So, and after that, they approached the National Department of Agriculture, National Treasury, which then ended up withholding the grants, which raised concerns on non-compliance to PFMA and other processes. So therefore, the role of EXCO in the initial stages of the project cannot be ignored, because in the infancy of the project, submissions were made for the approval of EXCO, but I believe that they would have been preceded by robust deliberations. And this is confirmed by the Premier, by the former Premier in his statement to the Public Protector. And I therefore incline to believe that as EXCO, the members did not just rubber stamp what was presented to them, especially the project was funded from the Free State provincial government and considered a flagship project of the province. So in terms of Section 125 of the Constitution, the members of the provincial executive are entrusted with providing coherent strategic leadership and coordination in policy making, implementation, and overseeing service delivery, planning, implementation in support of national and provincial priorities in line with the provincial budget plan, and are further held accountable for their decisions as EXCO members collectively and individually in accordance with Section 133 of the Constitution. I am therefore clear in my understanding of the responsibilities of EXCO and safely conclude that the Freire project and its proposed implementation could not have been left solely to the accounting officer with no oversight from EXCO. So from the evidence submitted, various engagements were held by the Office of the Premier, the DG, Legal Services in the Premier's Office, and the HOD regarding the conclusion of the agreement with Estina. And it is therefore difficult to believe that the officials did not provide the Premier with regular status reports on the project. As such, I'm also inclined to conclude that the former MEC, whose portfolio it was, and the project was his brainchild, Mr. Zwane, was also, as well as the former Premier, were aware of the proposals that resulted in such agreements being concluded with Estina. In fact, evidence adduced from Mr. Mutaung, Mr. Tabete, and the intended beneficiary put the involvement of the former MEC Zwane in the project, especially at its conception, because he was the MEC for 1 year when the project was established. And from Mr. Makhashula's submission under oath that he had no involvement of the project is not the evidence which we found, because from the evidence which was discovered is that he was involved when this project was presented at EXCO, and from evidence in my possession as well, Mr. Makhashula appointed Mr. Narayan as a special advisor in the Premier's office a day after he had approved a memorandum that Mr. Narayan would undertake a trip to India with Mr. Tabete for the purposes of the Freire dairy farm, and at the estate expense, which again, however, in his response, Mr. Makhashula has vehemently denied any complicity in Mr. Narayan's employment in the Free State province. The evidence indicates that the quotation to the trip for Mr. Tabete Narayan was approved, and the said trip was then approved by Mr. Zwane and then was sent to the Premier to also approve. And the role of Narayan in the project, both prior and subsequent to his appointment to the Advisory Council in the Free State, has been alluded to by several parties which were interviewed. And again, that he was involved in the signing of the 99-year lease contract on the municipal land, and that Mr. Narayan was a director in a company called Siya Buselela Trading, together with Mr. Kamal Vazram, the sole director of Estina. also further that Mr. Narayan was appointed as part of the Premier's Advisory Council in February 2012. He was already known and prominent in the Free State, as stated by Ms. Rockman during her interview. So therefore it is evident that Mr. Narayan was known to the provincial officers as confirmed by Ms. Rockman, and that he was there in the early days when the Free State acquired New Age newspaper contract. In fact, was acquired by the Free State government. His subsequent involvement in the Frede further indicated the involvement of the Gupta family in the project, and he was known as a representative of their business interests in the Free State, as indicated by Mr. Rockman. So the evidence provided by Mr. Zwane during his interview with me, compared to the evidence Mayor Mutahung and beneficiaries provided, put him squarely in the center of the project as well, because he was the MEC for Agriculture. Therefore, his role in the conception and implementation of the project, which he portrays to have been minimal, is inconsistent with what he has subsequently said in the response to the Section 79 report, because during the explanation, he acknowledged that he was the brainchild to this particular report, though he only served for a year as MEC of Agriculture and before the project can be fully implemented. Further evidence by Rockman relating to her meetings with the Gupta family, firstly, at the request of Mr. Makhashula, that's what she said, on her way to EXCO meeting in Bethlehem, as well as other meetings at their residences regarding payment of the project, which was discussed during her visits to the family. But then in her response to the Section 79, Ms. Rockman had initially stated that during the interview with my team that these subsequent meetings at the residence were not at the request of Mr. Makhashula. So Ms. Rockman asserted that there was nothing unique, sinister, or untoward towards meeting private companies presenting to EXCO, or that she had visited the family. So the conduct of Ms. Rockman, where she met the family at their home in Saxon World, as well as their business premises, to discuss payments issued on the Frede project, was highly improper, as the visit had occurred on numerous occasions and therefore resulted in a possible conflict of interest between her official duties and private interests. At the time, she had placed herself in a position that compromised her credibility and integrity, as well as her position as DG in the Premier's office and later as MEC of Finance. So her conduct contravenes or violated Section 136B and 195 of the Constitution. And now I turn to the part of the beneficiaries, where evidence confirmed that National Treasury Accountant General submitted its report regarding the Frede Dairy Farm project to Mr. Makhashula and Ms. Kabati. So the report informed them of the financial irregularities that happened in the conceptualization of the project, and the Accountant General report made several recommendations to the Free State, which included, among others, stopping the funding towards the project until the proper risk management is done. After receiving the report, EXCO proceeded to approve the termination of the contract and transfer the project to FDC on the 16th of April 2014. But what is concerning, we have evidence that indicates that Estina was paid a further 30 million on the 21st of July 2014, as well as 60 million in 2015 and 46 million in 2016 again, as per approved by EXCO in the respective appropriation budget. So in his testimony to me, Mr. Makhashula stated that the Director General and Legal Services in the Premier's office were given this Treasury Accountant General's reports, and he felt that it was not yet conclusive, and they continued to work on the project. So similarly, Ms. Kabata indicated that during her interview with me, that even though there had been various meetings between HOD of Agriculture and Provincial Treasury, there had been no legal obligation on Agriculture not to continue funding the project. So the above statement provide both Ms. Makhashula and Ms. Kabate, which firmly confirmed again in responses to their Section 79 notice that the Accountant General raised serious concerns about the project and recommended that it should be stopped. Further allegations being investigated by the Accountant General report were not the first instances of alleged irregularity with regard to the project that had been made light at the time, but there were several reports about this. Surely EXCO was supposed to be concerned about the issues which are raised by various parties. In the circumstances, it's difficult to determine how the Department of Agriculture justified the additional payments due to Estina in terms of clause 15.3 of its contract for additional payments. It is profound that even though Department of Agriculture was intent on cancelling the contract with Estina after receipt of the National Treasury report, it made no attempt, legal or otherwise, to challenge Estina's claim for full payment of monies due to it. So Mr. Tabete's response in terms of Section 7.9, the Department of Agriculture contract with Estina, the latter was supposed to contribute 228 million towards the project. However, the Department of Agriculture never claimed such payment from Estina, especially when the latter persistently pursued them for outstanding payments after termination of the said contract. I must indicate that Mr. Tabete is the accounting officer. The report number 31 was dealing more on his responsibility. So in light of the foregoing, Mr. Makhashula, Ms. Rockman, Ms. Kabate, and subsequent appointed MEC of Agriculture, as well as EXCO, failed to take action or to stop further appropriation of additional funds for the payment to Estina and safeguard the provincial government from continuing to incur financial losses attributed to the project as after it was terminated, or to recover money from the implicated individuals, especially since the Auditor General had also been raising continuous audit concerns and made adverse findings around the project. Mr. Makhashula, Rockman, Kabate, and subsequent appointed MEC, as well as EXCO, also made no effort on their part to rationally interrogate and investigate the findings of the Accountant General report, including appropriation of additional funds. On the basis of the above evidence, I have come to the conclusion that the Free State Provincial Government EXCO, led by the former Premier, collectively failed to perform adequate oversight over the project when it appropriated additional funding for the project, ensuring that further payments were made to Estina. I have also come to the conclusion that the relevant MECs, in their individual capacity responsible for this project, failed to perform adequate oversight over this project to ensure that due diligence is conducted throughout the existence of the contract with Estina. They also failed to prioritize and protect the interest and welfare of the beneficiaries. And I have been aware as well that this matter is also investigated by NPA, but then they will focus on their own mandate. My conclusion with regard to issue 2, which is the beneficiaries, from the evidence is clear that the beneficiaries were involved. They were addressed by the Mr. Zwane at the inception of the project. Their details were collected, and they met with the community to discuss this. And once the funding has been secured by the Free State Provincial Government, the project still had to undergo 2 more phases before it could be rolled out to the beneficiaries. That's what it was said. It is apparent from the evidence that the Free State Provincial Government used the beneficiary names or list to secure the CASP funding, but failed to ensure that the project came to full fruition for beneficiaries to benefit, as the beneficiary list was never finalized through a verification process as initially committed. So the above conclusion is also supported by the evidence of one Ms. Meyer. In agreement that the blame for failure of the project cannot be placed on National Treasury as a result because of the Accounting General's investigation for having halted the project. So they were supposed to make sure that they address the concerns which were raised by the Accountant General before they proceed. So the conduct of Mr. Zwane, Ms. Kabate, and the MEC of DART was in direct violation of Section 195 of the Code, as they failed to administer their public office responsibility, which include principles of equality, human dignity, fairness, especially updating the complainants or the beneficiaries on how the project is ongoing. Further, the HOD failed the beneficiaries by not ensuring that Estina was accountable, transparent, but this was the finding in the earlier report. It is unfortunate that the beneficiaries were sold an empty dream by those who were elected and responsible to change the local community's lives for the better. Having regard to the above, the following findings are made, which is the allegation that there was political involvement in the Friede is substantiated, and then the allegation that the EXCO improperly appropriated funds to ensure payment of Estina even after Department of Agriculture has cancelled the contract is substantiated, and then the allegation that there was possible prejudice suffered by the intended beneficiaries is also substantiated. So therefore, in the light of the above, the following are the remedial action. The Premier of the Free State, the current one, to take note of the report insofar as the findings and remedial action contained therein are concerned, and as the Executive Authority assists in ensuring that the remedial action as provided for hereunder is expedited. Within 30 days of receipt of the report, ensure that the Speaker of the Provincial Legislature tables the report before the House for deliberations and consideration consideration of issues relating to my findings under paragraph 6.1 to 6.5 of the report by members. Within 30 working days of receipt of this report, ensure that measures are put in place for the members of EXCO to be inducted and sufficiently trained on their accountability and oversight responsibilities as provided for in the relevant sections of the Constitution. Within 30 working days, consider my findings insofar as they relate to the MEC Kabate, who will also have to be taken through the process of this training and induction. And the MEC of Agriculture should issue an apology letter to the beneficiaries, and the second one should conduct an audit on all the beneficiaries of the project for purposes of having a database of all of them and their heirs of those who unfortunately passed on. And within 60 days of this report, ensure that the project is revived and the beneficiaries as 51% shareholders are full participants in the project along the same vision of Muhuma Mobung as was envisaged by the Free State Government's EXCO when it launched the Friede Dairy Project as its flagship. The head of the priority crime investigation, which I think in your statement it relates to NPA, which in the final report is not the NPA but the Directorate for Priority Crimes, this matter will be referred to them. As I conclude, I look forward to the acceptance of the findings and full implementation of the remedial action in all the above reports in the interest of good governance and the rule of law. Where clarity is needed, we are available to assist. I wish you all a wonderful festive season, a prosperous new year. Let us stay safe on the roads, continue taking precautionary measures to cushion ourselves from COVID-19. Thank you.
Thank you, Public Protector and Deputy Public Protector. I will now take questions from the floor. We have a few journalists in the room, and the rest are following the proceedings online in strict adherence to social distancing measures. So I will be keeping an eye on our WhatsApp group where the questions are supposed to trickle in from those who are following the proceedings virtually. But we will first give the opportunity to those that are in the house with us to pose their questions for clarity to the panel. I see ENCA's and is up, and so is that of the SABC. Let us start with Mr. Gordon Wickles from ENCA and follow with Uvent.
Hi, thank you, Public Protector. It's Govan here from ENCA. The first one relates to the report on the city of Johannesburg. We've seen now that Mr. Mashaba intends on challenging the report due to what he calls errors in law. My question is on the confidence you have in this report and its standing in court. Do you believe that this will stand? Then secondly, on the Freda Dairy Farm report, you mentioned that the former Premier had raised concerns around the jurisdiction of the Public Protector, and we had seen the jurisdiction of the PP coming up as a point contested in court before. In this case, are you confident that that will also stand? And then lastly, do you believe that your findings and remedial action related to persons who are no longer in government office, such as Mr. Mkhwebane and Mr. Zwane, have the ability to achieve the accountability that you are intending? Thank you.
Offenses team of SABC News. Public Protector, I heard you mention that the former Premier Ace Makhashule's assertion under oath was actually contradicted by evidence that was established. So does this mean that there would be repercussions for him making an incorrect assertion under oath? Thanks.
Thank you. In the absence of any further questions from the floor, I will hand over to the Public Protector to respond to the 4 questions that have been posed thus far, 3 coming from ENCA and the last one from the SABC. Thank you.
Okay, thank you for the clarity-seeking questions. I don't know, when you say Mr. Mashaba says he will challenge the report even before receiving the report because of errors of law and whether it will stand in court. I don't know based on what, but what I would say is that the investigation team by the Public Protector team in Gauteng, they've conducted the investigation. We have all the evidence before us, and I wouldn't comment about the court because anyway you'd find that a person will raise a technical issue in court, and you find that the court doesn't even deal with the merits of the matter and also the issues of, well, they will deal with the issues of interpretation of the law and whether that was supposed to happen, but you'll find that the issue of justice is not handled. And again, what areas should people learn from our reports? Because the Constitution is very clear that the remedy should correct any malfeasance from recurring. That's the purpose of the Public Protector reports, and I think the Constitutional Court also in the Nkandla judgment was very clear in saying what is an appropriate remedy, to uproot any challenges. I mean, for Mr. Mashaba to have his company or the wife's company, the issues of conflict of interest, or as well that clouding possibly his judgment in awarding or interfering in how contracts are awarded. I think that should be a lesson for other mayors not to involve themselves in procurement spaces. So the Friede issue, Mr. Makhashule was contesting the Section 6.9, the issue of special circumstances. Why am I continuing to investigate the matter? And I think if taken on review, it's for the court as well to decide. I wouldn't say because I've used my discretion that this matter is of public interest and we should be resolving it to finality, and that's basically to make sure as well that the complainants or the beneficiaries are finally, their matters are addressed to finality. And the findings to Makhashule and Zwane, well, because they've left, I think the critical issue again is still the fact that the reports are not only issued because we would want to, we are not a court of law, we are not finding people guilty, but this report should be utilized by the current Premier. As you've seen, I said, should be tabled in the provincial legislature, it should be deliberated on. And accounting, in fact, the executive authority, MECs and the ministers, this is a lesson for them that you don't just approve a project and just let go of the accounting officer, the DG or HOD, to run with the project and you don't have anything to do. But you have the oversight responsibility in terms of the Constitution and to hold the accounting officers to account, and you know what is happening in the project. So, offense, the assertion under oath, and it's incorrect. What he said under oath was his version of events, but then we are now showing to him the evidence which we are having. It's not a question that he lied. It's a question that you presented your matter as follows, but we have the evidence which is contrary to what we are saying. Yeah.
Thank you, Public Protector. I don't know if there are any more questions from the floor colleagues. I see on the WhatsApp group things are still quiet. So, okay, the Newsroom Africa has a question to pose.
Thank you, PP. Belan Pahadia from Newsroom Africa. Just maybe on a lighter note to yourself, has the Constitutional Court perhaps brought some relief to yourself, not only personally, but to setting precedent on putting some loopholes, or even asking why there are some court reverts that claim to be at cost to you personally? Will that perhaps bring some precedents that you say is much welcomed, so that when you are challenged and successfully, you don't have to pay for the cost?
Thanks, Paddy. I think, yes, it was, it brought some relief, not only on me, because whatever is happening impacts on the public protector staff. Remember, these investigations are conducted by them. Yes, unfortunately, the buck stops with me because I'm the one who's signing these reports. But also the investigative staff feel that, I mean, it's like possibly putting or, setting up somebody for failure. But I think it also helps that the Apex Court especially pronounce on this particular matter. And again, it will also help those who are still aspiring to be lawyers, because some have been disappointed or discouraged because of what is happening, to also understand what are the requirements for courts or judges to look into before they issue personal cost orders. So I think it will assist a lot, because one is performing public function, not here as the Busisiwe Mkhwebane in my own house issuing these reports. These reports are issued within my responsibility as the public protector, being assisted by the investigative staff. Indeed, this has helped, and I hope the courts will focus more on the merits of the matter, being objective, also focus on what we intended to address by issuing such reports. Thanks.
Public Protector, I see there's one more question from Gordon.
Thank you. Sorry, I had not addressed this in the initial question because we were dealing with the other reports. And this one relates to the report on the PPE investigation, and the Deputy Public Protector, you had laid out an indictment of South Africa's public hospitals during the COVID-19 pandemic, even describing medical waste laying in corridors and positive patients at hospitals that were treated on beds without linen, having to bring linen. So we've seen in the most recent address by the President, he said that during the lockdown, South Africa had capacitated its healthcare institutions and hospitals to respond to the COVID-19 pandemic. So I'd just like some clarity on the timelines that this investigation encompasses, and whether at the end of your investigation you were able to see any improvement in the provision of PPE or standard of the hospitals to respond to COVID, or or whether you can comment on what the current status of these hospitals, whether this situation is what's happening now, or whether this situation had been addressed and is now better to respond to. Thank you.
Thank you, Gavin. At this stage, our provincial officers have sent Thank you, Gavin. At this stage, our provincial officers have sent some questions to the provinces for us to conclude our investigations, to respond to these particular aspects on what has been done in this regard. We have not conclusively received those responses as the time frames have not expired. But it is clear from reports that are taking place that some of the issues, particularly in respect of PPEs, have been addressed, but even though they might not have been addressed fully. And we also hope that, pursuant to the meeting that we had with the Minister of Health and also the factual report that we have read out today, which has been sent to the Minister of Health and the provinces, we will receive conclusive responses as to what is the position in regard to these areas that we have identified of being a major threat, especially during this period of the pandemic.
Thank you, DPP. I don't see any more hands from the floor. I have not received any via the WhatsApp line. I take it that we have come to the end of the press conference now, and I hereby adjourn the proceedings.